We have lost so much during the pandemic. Some of you a job, financial security. But it's also taking a toll on our health outside of the virus itself. Tim Miller found out you could be at a greater risk of cancer.
Ordering everyone but essential workers to stay at home.
The world economy is shaken as factories in China shut down.
That the economy's losing $100 million every hour during the shutdown.
It was the time when our world changed like never before, March 2020. The spreading coronavirus shuts down so much that we knew that we took for granted.
What we do now will slow this invader.
Shutdowns at our workplaces, schools, and favorite restaurants changed our lives, but they've also taken lives. A study published in October in the journal Preventative Medicine found that in April of 2020, breast cancer screenings funded by the CDC declined by 87%, and cervical cancer screenings dropped by 84% compared with the previous 5 years.
We basically shut down mammography services for several months.
When the shutdown happened and stay-at-home orders were put in place, doctors' offices shut down, including important mammography services. Dr. Constance Cashin, a Mercy Health breast cancer surgeon, says mammographies were canceled for a few months last year to keep patients away from the coronavirus, and Mercy Health is still trying to catch up. They are 30% behind where they should be on screenings and are even calling women right now on the phone who miss their mammographies.
I have sadly seen us see ladies who were quite advanced, and you just worry that had they been identified 3-4 months earlier, or they were very fearful and just haven't come for over a year, that, now they had disease that had already metastasized.
Don McMullen was almost a pandemic statistic. A nurse in the ICU at Mercy St. Charles Hospital, she got COVID late last year, recovered, then got the COVID vaccine in January. But then doctors found an enlarged nodule in her lymph system.
I was having some weird symptoms, but they were more, to me, they were, I was dizzy and I couldn't focus.
Since COVID shots can show inflammation in the lymph nodes, Dawn was told to wait 12 to 16 weeks to have it checked further. But she had a bad feeling and talked them down to only 4 weeks. Well, thank goodness she didn't wait any longer. The nodule had grown significantly in those 4 weeks. And in March, a biopsy confirmed she had breast cancer. The COVID pandemic almost cost her life from cancer.
My oncologist said that if I would have waited that extra 12, 16 weeks, that my actual diagnosis could have very well been terminal.
But not everyone has been so proactive. Other cancers could explode because of a sharp drop in screenings. A recent study in Spain found a more than 40% decline in colon cancer diagnoses. That doesn't mean fewer people are getting colon cancer, just that a lot fewer people are getting screened and finding it. They're not getting life-saving colonoscopies.
I would love to have a day where we don't lose anyone to colon cancer.
Dr. Eileen Sipe, a colorectal surgeon with ProMedica, believes in 10 years, colon cancer could be the #1 cause of cancer deaths in 20 to 49-year-olds. A decrease in screenings, colonoscopies, could cause dangerous ripple effects.
We're definitely seeing younger persons affected, and these are persons that are completely surprised by their diagnosis, and it's completely affecting them in the prime of their life.
That's where you come in. The recommended age to get your first colonoscopy used to be 50, it's now 45. Pandemic or not, don't wait.
Even now, every day I see people and they kind of use it as an excuse. They go, well, 2020 was a wash, and I go, I'll give you a pass on that, but we need to keep going forward.
Dawn McMullen now has a great chance to be cured of her breast cancer because she didn't wait to be screened, didn't let the pandemic control her life.
I'm just a fighter. I'm a fighter for my patients. I'm a fighter for my family. And actually, this is probably the first time I fought for me. And I'm winning.
Tim Miller, WTOL 11.
Tim, thank you. If breast cancer is found early and is localized to the breast, there is a 99% 99% 5-year survival rate. We wanted to get that out to you tonight. Also, Dr. Sipes says when colorectal cancer is found in stage 1, it is more than 90% curable.